Integrating mental health awareness and action into our schools has this spring become a very important buzz phrase, if you will, in our schools. However, it's so much more than that and has always been so much more than that. This is especially true following tragedies such as that which occurred in Marshall County on January 23rd of this year. As mental health and our collective awareness and understanding of mental health, its importance in our schools, becomes more prominent, we have to take more time to learn the various ins and outs, to become connected to mental health professionals in all our communities, not just the larger cities. Even though mental health issues in our schools have always been a little bit complicated, maybe even a little bit scary and taboo, it is a topic we have to take on as educators. We don't have to do it alone, however. It's really important that we involve mental health professionals in our community, that we work hand in hand with kids, with their families, as we work through the various phases of assessment, understanding trauma-informed care, understanding the responses necessary, working together to see a child and his or her family through that process. There are several areas to consider as we continue to work to integrate our knowledge of mental health issues in our schools and how we keep kids not only physically safe, but emotionally safe throughout every school day. First, we have to understand who those professionals are in our community to be able to connect them with our families, with our kids, in a way that is proactive for everyone. The Center for Disease Control estimates that about 20% of all kids suffer from debilitating mental health issues. We have to be prepared in this day and age as educators to move this sometimes scary discussion into the light so that it brings comfort, brings emotional safety to those children and to their families and to other children in the school as well, so that we can maximize those learning opportunities. Next, we have to understand everything we can about mental health assessment process. NPR has called mental health issues in our schools a secret epidemic. We have to work through that with skill, with knowledge, with understanding about appropriate responses as we work through an issue that can be so very difficult in our schools at all levels. Next, it's incumbent on us to learn about trauma-informed care and its importance as we work through the far-reaching implications of addressing mental health issues in our schools. We have to understand how to recognize it, what those responses might be, and how to best communicate that with families. It has to be an ongoing, strong level of communication among families, among schools, and among mental health professionals. We have to understand, again, as educators, how to fully integrate that knowledge with effective policy making so that throughout our Commonwealth we're able to better address the needs of those suffering from mental health issues. Understanding in our schools that typically we have about maybe 500 kids for every counselor or mental health professional in our schools. We have to combat those numbers with staffing, with increased staffing, and find ways to do that. As we continue to struggle and work toward converting our knowledge, our understanding into effective policy, it is our hope that we can move in that direction of making mental health issues in schools not quite so scary, but yet another challenge through which we can enhance every child's educational experience.